Join our monthly online Zoom course for discussions, practice, and supervised training. We also offer special one-on-one Zoom courses for personalized guidance. For more tips, watch our videos and subscribe to our YouTube channel. Thank you.
In today's world, with information just coming at you constantly, it really is easy to feel overwhelmed, isn't it?
Mm-hmm.
But what if you could just cut through all that noise, get
Yeah.
straight to what really matters?
Yeah.
Well, that's what we aim for here on the Deep Dive. We sift through sources, research, all of it, and try to pull out the key stuff, the surprising bits, and talk it through like a conversation, not a textbook.
Right.
So today we're tackling a pretty serious but really vital topic, bladder cancer.
Yeah, it is important.
Our goal is to get you the absolute must-know facts, the symptoms to really watch for, and give you a sense of the path for diagnosis and treatment. It can sound heavy, I know, but honestly, understanding this stuff is empowering.
Absolutely. And focusing like this, especially on health topics, is just so valuable. Knowing the signs, knowing what the process looks like, that can genuinely make a huge difference to how things turn out.
Mm-hmm.
This deep dive is really about equipping you with that crucial knowledge clearly and hopefully pretty accessibly.
Okay, great. So let's kick things off right at the beginning. What is bladder cancer, fundamentally? Can you break down that core definition for us?
Sure. So at its simplest, bladder cancer is cancer that starts in the cells that line your bladder, the organ that holds your urine.
Okay.
But it's not just one single thing. There are different types depending on which cells it starts in. The most common one, we're talking like 90% of cases, is called transitional cell carcinoma or urothelial carcinoma. That starts in the cells lining the inside.
Right, the urothelial cells. And when we talk about how serious it is, does that vary a lot, or is it always sort of equally severe?
Oh, that's a really good question. No, it's definitely not uniform. Our sources show it really depends on a few key things.
Like what?
Like the cancer size, for one. Then critically, whether it's grown deeper into the bladder wall or if it's spread elsewhere in the body. And also, the person's general health plays a big part too, other health conditions they might have. All these factors help the medical team figure out the outlook, the prognosis, and how best to treat it.
Got it. And who tends to get this more? Are there clear demographics?
Yeah, the data is pretty consistent. It's significantly more common in men than in women, and the risk definitely goes up with age. Most people diagnosed are over 60.
Okay.
But here's the bit that often surprises people, maybe the biggest takeaway on risk. Smoking. It's named as one of the main causes, not just a factor, but a primary one.
Wow. Okay. That's really striking. The emphasis on smoking as a main cause. Why is that? What's the link there specifically with the bladder?
It's actually quite a direct pathway, which is maybe why it's so strongly linked.
Mm-hmm.
When you smoke, those harmful chemicals get absorbed into your blood.
Right.
Your kidneys then filter these toxins out, and they become concentrated in your urine.
Ah. Okay.
So the lining of your bladder is then directly exposed to these carcinogens, these cancer-causing chemicals, often for hours at a time between peeing.
Right, just sitting there.
Exactly. And that prolonged exposure can damage the cell's DNA over time, making those cancerous changes much more likely. It really highlights how lifestyle choices can have these long-term cumulative effects right down at the cellular level.
That makes total sense when you put it like that.
Yeah.
Okay, so we have that foundation. Now let's move to the symptoms, those silent signals. What's the absolute number one thing, the critical symptom our sources really flag?
Yeah, the big one, absolutely number one, is blood in your pee.
Yeah.
The medical term is hematuria.
Okay, blood in the pee.
And here's the crucial bit, the part people sometimes miss.
Hmm?
Any blood, even if it's just a tiny speck, or maybe looks pinkish, even if it's the very first time it's ever happened, or even if you're not totally sure it is blood.
Right.
The advice is unanimous. You need to see your GP urgently, or, contact NHS 111 here in the UK, or whatever your local urgent medical advice line is. It needs checking out straight away.
So even if it's faint or just happens once and you feel totally fine otherwise, no pain or anything.
Precisely. That's the trap, isn't it? People might think, oh, it's probably nothing, or it went away, so I'm fine.
Yeah.
But the sources are really clear. That's exactly when you need to be vigilant. Acting quickly on that first sign, even a small amount of blood, is key for early detection. And early detection often means treatment is much simpler and more likely to be successful.
Okay. And what might that blood look like? You said pinkish.
Yeah, it could be bright pink or proper red, or sometimes even a dark brown, almost like cola. And it might come and go. It's not necessarily there every single time you pee.
Got it. So besides blood, what other symptoms should people be aware of, even if they're maybe less specific?
Yes, there are definitely others, though, like you say, they can be caused by lots of different things, often much less serious things like infections.
Right.
So these include things like pain or burning, stinging, maybe itching when you pee, getting urinary tract infections, UTIs frequently, or ones that keep coming back.
Okay.
Also needing to pee more often than usual or feeling that sudden, really strong urge to go, like you can't hold it.
Mm-hmm.
And then sometimes, in more advanced cases, you might see things like losing your appetite for no reason, losing weight without trying, persistent pain in your lower back or lower tummy, maybe aching or tenderness in your bones, and just feeling really tired or generally unwell without a clear cause.
That's quite a list. So if someone's experiencing some of those, especially the less specific ones like peeing more often, what's the message? Don't panic, but...
Exactly that. It's not about immediate panic.
Yeah.
Connecting it back, it's about being informed enough to think, okay, this isn't quite right. I should get it checked. Not trying to diagnose yourself online or just ignoring it.
Yeah.
Things like needing to pee more or getting UTIs, they are super common, especially in women. So having those symptoms absolutely does not mean you have bladder cancer.
Right.
But it does mean you should see your GP, let them figure it out. That checkup is the essential step.
And what should someone expect at that GP appointment if they go in saying, I've noticed X, Y, or Z?
Well, the GP will definitely ask lots of questions about your symptoms, when they started, your general health, any past medical issues.
Okay.
Then, depending on what you tell them, they might need to do a physical exam. This could potentially involve checking inside your bottom, that's a rectal exam, or for women, inside the vagina. They use a gloved finger just to feel for any lumps or anything unusual.
Right.
It's important, you'd need to undress from the waist down for that part, but you absolutely have the right to ask for a male or female doctor if you have a preference, and you can always ask for a chaperone.
What's a chaperone exactly?
It's usually a nurse or another trained member of staff who stays in the room with you during the examination, just for support and, well, propriety. You can even ask for someone you know to be there sometimes.
Okay, that's good to know.
And they'll almost certainly ask for a urine sample to test for infection or blood cells, and maybe do some blood tests as well.
That's really helpful, outlining that initial step. Okay, so we've covered what it is, the key signs. Let's pivot now to the why, the risk factors. What does the research show about who's more likely to develop bladder cancer?
Yeah, the why is complex. The exact cause isn't always known for every single person. But the research definitely points to several factors that increase the risk.
Okay.
We already mentioned age, being over 60 and being male. Those are significant. And as we discussed, smoking or even using chewing tobacco is a really big one.
All right, the smoking link is clear. What about other things like work or environment?
Yes, absolutely. And this is something maybe people don't think about as much. Certain jobs involve long-term exposure to specific chemicals that are known to increase risk.
Like what kind of jobs?
Things like working in the textile industry with dyes, or handling substances like industrial chemicals, rubber, leather, paint, or even carbon or crude oil. That long-term exposure, often over many years, can be a factor.
So it could show up years later.
Often, yes. Long after someone has stopped working in that environment. It really highlights why workplace safety, using protective gear, is so important in those industries.
Makes sense. Any other factors?
A few others mentioned in our sources include having a urinary catheter in long term, having had radiotherapy to the pelvic area before, perhaps for another cancer, being significantly overweight is also linked,
Okay.
and having a close relative like a parent or sibling who's had bladder cancer suggests there might be some genetic links sometimes. Also, certain medical conditions like diabetes and, historically, an infection called schistosomiasis or bilharzia, though that's rarer in many parts of the world now.
That really paints a picture, lifestyle, genetics, environment, all potentially playing a role. So knowing we can't always prevent it, what can people do? What are the actionable steps to lower the risk?
That's the key question, isn't it? Prevention isn't guaranteed, but risk reduction is definitely possible. The absolute top actions, based on the sources, are: number 1, try to quit smoking. Given strong link, that's huge. Number 2, if you're overweight, making efforts to lose weight can help. And number 3, if you work in one of those industries with chemical exposure, being really diligent about using protective clothes, masks, following all the safety guidelines.
So this raises that question again. How much control do we actually have here? Where should the focus be?
Well, it's about focusing on what you can control, isn't it?
Mm.
And the interesting thing is these actions, quitting smoking, managing weight, they aren't just good for lowering bladder cancer risk.
Yeah.
They're beneficial for your overall health in so many ways, reducing risk of heart disease, other cancers, diabetes. So you're making positive changes across the board. It's an investment in your general well-being.
That's a great perspective. Okay, let's fast forward. Someone's seen their GP, maybe had those initial tests, and the GP thinks something needs further investigation. They get referred. What happens then? What's the next stage in the diagnostic journey?
Right. So after the GP referral, you'll usually see a specialist, typically a urologist, at the hospital. And this is where they do more specific tests to get a clearer picture.
Okay.
The main test they use to look directly at the bladder is called a cystoscopy.
Cystoscopy, right. What does that involve?
It involves passing a very thin, flexible tube. It has a tiny camera and a light on the end called a cystoscope. It goes through your urethra, which is the tube you pee out of, and up into your bladder.
Okay.
This lets the specialist actually see the inside lining of your bladder on a screen, looking for any abnormal areas, growths, or anything suspicious.
That sounds, well, potentially a bit uncomfortable.
Yeah, it can sound daunting. The sources say it might be uncomfortable, but it shouldn't actually be painful. They usually use a local anesthetic gel to numb the area beforehand.
Okay.
Or sometimes they might give you pain-killing medicine. In some situations, perhaps if they expect to do more than just look, it might even be done under a general anesthetic, so you'd be asleep.
And can they do anything else during that procedure?
Yes, that's a key part. If the specialist sees an area that looks concerning during the cystoscopy, they can take a small sample of tissue from the bladder lining right then and there. That's called a biopsy.
Oh, okay.
That tissue sample then gets sent off to a laboratory where it's examined under a microscope by a pathologist. And that's really how they confirm if cancer cells are present, and if so, what type and grade it is. It's crucial for diagnosis.
Receiving that diagnosis, if it comes back as cancer, must just be incredibly tough, overwhelming. What kind of support kicks in for patients at that point?
Oh, absolutely. It's bound to be a shock and feel very overwhelming. But the important thing to know is you are not expected to go through it alone.
Right.
Right from that point of diagnosis, a whole team of specialists gets involved in your care. This multidisciplinary team, or MDT, usually includes surgeons, oncologists who specialize in cancer treatment, maybe radiotherapists, and very importantly, usually a clinical nurse specialist or CNS.
And what's their role, the CNS?
The CNS is often your main point of contact. They're there to help explain things, answer your questions, and you'll likely have loads talk you through procedures, offer emotional support, and generally act as your guide and advocate throughout the whole process. They're a really key resource.
That sounds incredibly valuable. So once cancer is confirmed, what else needs to happen before deciding on treatment? Are there more tests?
Yes, usually there are. Once the diagnosis is confirmed by the biopsy, the next step is staging the cancer.
Staging. Okay.
Staging is really important because it determines precisely how advanced the cancer is. They need to find out its exact size, the specific type. Has it grown into the deeper muscle layer of the bladder wall, or has it spread beyond the bladder to nearby lymph nodes or even other parts of the body?
Right. And how do they find that out?
Through more tests. These often include imaging scans like an ultrasound, an MRI scan, or a CT scan. Blood tests are usually done too. And sometimes if they suspect it might have spread to the bones, a bone scan might be needed.
Okay.
All these results get pulled together, discussed by that whole specialist team, the MDT, and they use that complete picture, along with your general health, to work with you to decide on the very best treatment plan for your specific situation.
It really sounds like a very tailored, personalized approach. So what are the main treatments available for bladder cancer once it's staged and understood?
That's right. It's very personalized. And the good news is that bladder cancer, especially when caught early, can often be treated effectively, sometimes even cured.
That's encouraging.
The main treatments really depend on all those factors we just mentioned: the type, stage, location, spread, and your overall health. Surgery is very often the main approach.
Okay.
But treatment plans can also involve chemotherapy, radiotherapy, and increasingly newer treatments like targeted medicines or immunotherapy. Your team will walk you through all the options, the pros and cons, potential side effects, and support you in managing those side effects too, with regular follow-ups.
Could you maybe just briefly touch on what each of those main treatments involves surgery, chemo.
Sure. So surgery, as I said, is often central. It can range quite a bit. For early stage cancer just on the lining, they might remove it during a cystoscopy procedure called a TURBT transurethral resection of bladder tumor. For more invasive cancer, surgery might mean removing part of the bladder, or sometimes the entire bladder, which is a major operation called a cystectomy. If the whole bladder is removed, they also need to create a new way for urine to leave the body, either using a piece of intestine to create an internal pouch or creating an opening on the abdomen called a stoma, where urine collects in an external bag.
Right. That's significant surgery.
It is. Surgery might also be needed sometimes just to unblock the tubes from the kidneys if the cancer is pressing on them.
Okay. What about chemotherapy?
Chemotherapy uses anti-cancer drugs to kill cancer cells. It can be given in different ways for bladder cancer. Sometimes it's put directly into the bladder itself, usually after a TURBT, to help stop the cancer coming back. That's called intravesical chemotherapy.
Oh.
Or, for more advanced cancer, it might be given intravenously, meaning into a vein, so it travels through the bloodstream to reach cancer cells anywhere in the body. Chemo might be used before surgery to shrink a tumor, or after surgery, or sometimes combined with radiotherapy.
Got it. And the newer ones, targeted medicines and immunotherapy.
Yes, these are really exciting areas of development. Targeted therapies are drugs designed to specifically target certain molecules involved in cancer growth. Immunotherapy aims to harness your body's own immune system to help it recognize and attack the cancer cells. These are often used in specific situations, perhaps if the cancer has a high risk of coming back, if standard chemo hasn't worked, or if the cancer has spread. They're becoming increasingly important options.
And finally, radiotherapy.
Radiotherapy uses high-energy X-rays to destroy cancer cells. For bladder cancer, it might be used instead of surgery, sometimes combined with chemotherapy. That's called chemoradiation, especially if someone isn't fit enough for a major operation. Or it can be used to treat cancer that has spread, perhaps to relieve symptoms like pain.
Wow. Okay. It's reassuring, actually, to hear there are so many different approaches and that dedicated team is there throughout.
Absolutely. That support system, the specialists, the CNS nurse, they are crucial. They explain everything, help manage side effects, monitor progress through regular checkups. You're definitely not meant to navigate it alone.
Now, we also need to talk about the really tough scenario. When bladder cancer is diagnosed at an advanced stage, and maybe it's not possible to cure it, what happens then? How does the focus of treatment change?
Yes, that's a very important and difficult situation to address. When advanced bladder cancer can't be cured, the goals of treatment do shift quite significantly.
How so?
The main focus becomes less about trying to eliminate the cancer entirely and more about controlling it. So slowing down its growth and spread as much as possible. And crucially, managing any symptoms caused by the cancer, things like pain, fatigue, nausea, to maintain the best possible quality of life for the person for as long as possible. It's about maximizing comfort and well-being.
So for people facing that incredibly difficult diagnosis, what does that mean in terms of the support available? Is there a specific team for that?
Exactly. In this situation, you'll often be supported by a symptom control team, or what's known as a palliative care team.
Palliative care. Okay.
Their absolute focus is on managing symptoms effectively and providing comfort. They are experts in pain relief and managing other distressing symptoms. But importantly, their support isn't just medical, it's holistic. They offer emotional, psychological, and practical support not only to the patient, but also to their family and loved ones, helping everyone navigate that incredibly challenging time.
That sounds like vital support. Okay, as we start to wrap up this deep dive, let's just quickly recap the absolute key takeaways. What are the most crucial points you want listeners to hold on to from our discussion?
I think number one is knowing your body and trusting your instincts. Number two, that single biggest symptom, blood in your pee. Any amount, any time needs checking urgently. Don't ignore it.
Right.
And number three, knowing that if it is bladder cancer, there's a whole system of support and a range of tailored treatments available, guided by a dedicated specialist team. Hopefully, this deep dive has armed you with that knowledge, making it feel less overwhelming and more manageable.
Definitely. Empowering people with that understanding was exactly the goal. Now, beyond all the facts and practical advice we've covered, what's maybe one final thought you'd leave our listeners with? Something to ponder.
A final thought. Maybe think about the sheer progress that's been made in medicine, how we can now diagnose things with such detail, understand the specific type and stage of a cancer like this, and then tailor treatments so precisely compared to even, say, 20 or 30 years ago.
Yeah, it's incredible, really.
So perhaps the provocative thought is, how does ongoing research, often fueled by the very experiences of patients going through this, continue to push those boundaries? How is it constantly reshaping what's possible in treating conditions like bladder cancer, offering new hope and improving outcomes year on year?
That's a fantastic point. A real reminder of the dynamism of medical science and the hope that brings. Well, thank you so much for sharing all that insight today.
My pleasure.
And thank you, our listener, for joining us on this deep dive. Remember to stay curious, keep informed, and always, always advocate for your own health. We'll see you next time on The Deep Dive.
Join our monthly online Zoom course for discussions, practice, and supervised training. We also offer special one-on-one Zoom courses for personalized guidance. For more tips, watch our videos and subscribe to our YouTube channel. Thank you.